Hi, and welcome to Cora. In this short training, you will learn how Cora supports your patients between sessions, how you can bill for your work with Cora, and how to easily onboard and monitor patients using the platform. As therapists, you know that most of the work actually happens between sessions. Cora extends your care between sessions. It guides patients through exercises and homework with reminders and step-by-step support, so they actually practice skills in real life. Cora also offers evidence-based therapeutic support when you are not with them, helping patients manage mood, anxiety, and day-to-day challenges between appointments. Cora is covered by Medicare, Medicaid, and all commercial insurances under existing remote therapeutic monitoring and care management frameworks. Cora is not just a clinical tool, it also supports your practice financially through well-defined CPT codes. You can use CPT 98978 and 98986 for monthly billing for the data collected and transmitted using Cora. This falls under Remote Therapeutic Monitoring of Cognitive Behavioral Therapy. You can also use CPT 98975 for the time you spend setting up a patient on Cora and educating them on how to use it. A therapist will spend 10 minutes or more per month per patient to review Cora data, modify treatment plan, and at least one phone or video call with the patient. The time spent is reimbursed by insurance. CPT 98978 for time spent between 10 and 19 minutes. If the time spent is over 20 minutes, use the CPT code 98980. Use CPT 98981 for each additional 20 minutes of that non-face-to-face treatment management work in the same month. Onboarding patients to Cora is intentionally simple. When you join Cora, you receive a unique QR code and URL. In session, you share that code or link with your patient. They download the app and are automatically linked to you. You will then see them appear in your Cora portal as one of your patients. Depending on your clinic or practice policies, the patient may also see additional consent language or forms when they sign up, which helps ensure you remain aligned with your organization's compliance and documentation standards.
To monitor your patients, you simply log into the Cora portal. The first page you see gives a summary of your patient onboarding, overall treatment plan adherence of patients, and a quick view of the claims. The patient screen is a summary of your caseload on Cora. On this dashboard, you can see how many of your patients are actively using Cora, the total number of sessions they have had with Cora, where a session can be a conversation with Cora or an exercise or homework they complete, and the average duration of these sessions. You can also see list of all patients on Cora, the number of sessions each of them have completed, the treatment plan assigned to them, and their adherence to that plan. This gives you a quick, high-level picture of who is engaged, who may be struggling, and where you might want to focus your attention before your next clinic day. When you are getting ready for a session, you can open your patient's profile in the Cora portal and quickly see how they have been doing between visits. Cora summarizes engagement with metrics like number of sessions, average session length, overall adherence to treatment plan, mood trends, and a wellness rating from 0 to 5 that reflects overall cognitive and emotional health. The wellness score is measured based on patterns in their language, mood swings, topic shifts, and risk signals, such as mentions of self-harm, community harm, or substance use. The Sessions tab shows all the conversations and exercises the patient did. You can drill down into any session to view the full transcript and the mental health conditions Cora identified. Then, switch to the Treatment Plans tab to inspect adherence at the level of each exercise. If you want to adjust care, you simply click Modify Plan to add, remove, or change exercises. Or you can use the Ask Cora feature. Either describe the type of plan you need, or paste in the diagnosis from your EHR, and Cora will propose a structured plan informed by past adherence and the wellness rating. Cora also gives its reasoning for suggesting the treatment plan. You can edit or accept the plan. Once you update the plan, it appears instantly in the patient's app. All of this information is also available as a patient report you can download from the portal. You can type your own clinical notes into this report, save them, revise as needed, and then submit the report as part of your documentation for insurance claims or your internal record keeping. Cora includes a growing library of more than 50 therapeutic exercises with new content added over time. These cover a range of evidence-based approaches, such as mood tracking, cognitive restructuring, breathing and grounding techniques, and reflective exercises. Before assigning an exercise to a patient, you can open it in the portal and review the full content and flow. That way, you can ensure it aligns with your modality, population, and session goals, and you can confidently integrate it into your treatment plan.
Welcome to your gratitude journaling exercise. Taking time to reflect on things you're grateful for has been shown to increase happiness and well-being. Tell me one thing you are grateful for today.
As mentioned earlier, the Cora service falls under 6 CPT codes. One of these codes, 98975, can be claimed once per episode. The other 5 codes can be claimed every month. Cora generates all the documentation required to file claims for these codes and ensures that all claim requirements are met. Once the requirements are satisfied, the therapist will receive an email from billing at thrive360ai.com. This email contains all the claims ready to be filed. The therapist simply clicks the link in the email and follows the instructions. For care management CPT codes, the therapist must provide the date and time of the patient call, which is a key requirement for claim submission. The therapist then reviews the report, confirms that the information is correct, and e-signs it. Once signed, the report is automatically sent for claim submission.
Cora is designed to do 3 things for you as a therapist: extend your care between sessions with structured, evidence-based support, give you clear, actionable data so your time in session is more focused and informed, create a sustainable billing path using existing RTM and care management codes without adding cost for your patients. The next step is simple. Log into your Cora portal, use your unique QR code or URL with your next few patients, and let them experience what it feels like to have you in their pocket between sessions. Thank you for being part of Cora and for the care you provide to your patients.